Erectile dysfunction is a common problem in men. It causes many problems in marriage and brings negative effects on the mental and health of our men. And what's worse is that erectile dysfunction is getting younger and younger. According to a study by the University of Massachusetts Hospital, about 52% of men between 40 and 70 years old are affected by erectile dysfunction to varying degrees. Don't worry though. Because in today's video, I'm going to share good news with you. There is a simple and natural way to support your sexual health, and that's through essential vitamins. Let's explore together how these vitamins can be powerful allies in the fight against erectile dysfunction, helps you not only improve your sexual health but also regain confidence and quality of life. And don't forget the last vitamin, because it is one of the deciding factors. 1. Vitamin C. This vitamin plays an important role in the production of nitric oxide, an important molecule that relaxes and dilates blood vessels. This process is essential for improving circulation and ensuring proper blood flow to the penis, helping to maintain a firm and long-lasting erection. If the body does not have enough vitamin C, nitric oxide production will be significantly affected. This not only affects erection quality but also increases the risk of heart problems. The question is, can vitamin C replace exercise? A recent study from the University of Colorado found that vitamin C has similar effects to exercise. An experiment was performed with 35 sedentary patients, mostly overweight or obese, divided into two groups. One group exercised and the other group did not exercise but received 500 milligrams of vitamin C daily for 3 months. The results showed that, in addition to the exercise group and reduced insulin levels, a substance that constricts blood vessels, the group that only took vitamin C had similar results, even a little better. Therefore, it is possible to partially replace exercise with vitamin C, but ideally you should consume at least 500 milligrams of vitamin C per day. To optimize the benefits of vitamin C, regularly consume foods rich in vitamin C such as oranges, lemons, peppers and broccoli. In this way, the circulatory system can be maintained well and more serious complications can be prevented. Similarly, it is important to avoid excessive alcohol and tobacco consumption, as these factors can interfere with nitric oxide production and make the situation worse. 2. Vitamin B3. Vitamin B3 plays an important role in improving blood circulation by improving blood vessel elasticity and promoting blood flow, can make a significant difference. A study published in 2011 found that men with mild to moderate erectile dysfunction took the supplement. Niacin had a significant improvement in the ability to maintain an erection. Another benefit you may not know is that vitamin B3 has antidepressant effects. For example, in Japan, vitamin B3 is used as part of alternative treatments for depression. This is a much-needed benefit for people suffering from erectile dysfunction. In addition, vitamin B3 also has anti-radiation properties. For example, after the Fukushima nuclear disaster in Japan, vitamin B3 is used to remove radiation from the body. Vitamin B3 has all these effects and also has antifungal properties against candida. Among the B-complex vitamins, this is the most beneficial. However, there is a problem: this vitamin has a detoxifying effect. When you start taking B3, your body begins to eliminate toxins and you may notice your face turning red. Don't worry, the redness will only last about 10 to 15 minutes and will disappear as blood circulation increases and the body tries to eliminate any toxins through the skin. That's why vitamin B3 is so important. To maximize the benefits of vitamin B3, incorporate niacin-rich foods into your daily diet. This include chicken, fish like tuna, turkey, and nuts like peanuts. 3. Vitamin A. Vitamin E is a powerful antioxidant that helps protect cells from damage caused by free radicals. According to a study published in 2019 by the Journal of Sexual Medicine, vitamin E can help improve blood circulation. In this study, men taking vitamin E showed significant improvements in erectile function compared to the control group. The trick to absorbing vitamin E effectively is to combine it with healthy fats, such as olive oil or avocado, because vitamin E is a fat-soluble vitamin. However, vitamin E comes in many different forms. There is natural vitamin E and synthetic vitamin E. They are not the same. Natural vitamin E is the one to look for because it has twice the cellular activity of synthetic vitamins. Natural vitamin E is called D-alpha-tocopherol. This is the most active form of vitamin E and is used by Dr. Wilfred and Evan Schutt as well as Dr. Linus Pauling because it gives the best results. Foods that provide natural vitamin E include spinach, avocados, almonds and sunflower seeds, very rich in vitamin E and beneficial for heart health. 4. Vitamin D. Vitamin D plays an important role in blood vessel health, which is essential for achieving and maintaining an erection. By improving endothelial health, the inner layer of blood vessels, vitamin D helps improve the flexibility and dilation of blood vessels, allowing for better blood flow. Without sufficient blood flow, a lasting erection cannot be achieved. In addition, vitamin D also affects testosterone levels, a hormone important to male sexual function. Studies have shown that low levels of this vitamin can reduce testosterone production, exacerbating erectile dysfunction problems. Many people think that sun exposure is not important, but that is not the case. When you are exposed to sunlight, your body produces vitamin D3 sulfate, a vitamin that helps prevent cancer and diabetes-related problems. Higher vitamin D levels have been shown to mean a lower risk of diabetes. Many people with diabetes are severely deficient in vitamin D. You just need enough exposure to the sun for your skin to start to take on a pinkish tint. Everyone has different sensitivity to the sun, so the time it takes for your skin to turn pink may vary. We are warned a lot about the dangers of sun exposure, but too much exposure can be harmful. If you get enough sun exposure to give your skin a slight blush, you'll have enough vitamin D over the next 2 to 3 days. 5. L-Arginine. Although not a vitamin like vitamin C, it helps produce nitric oxide, a compound that facilitates the dilation of blood vessels, thereby improving blood circulation. A 2016 National Institutes of Health (NIH) study indicates that L-Arginine may help improve erectile function in men with this disorder, with an improvement in erections of up to 50% in some cases. This amino acid is found in large quantities in foods such as red meat, fish, legumes, and nuts. One tip is to combine these foods with vitamin C, as vitamin C can support nitric oxide production. And now, let's move on to the most important vitamin today, 6. Folic acid. Usually, this compound is mentioned in connection with pregnant women because it is essential for fetal development. However, men can also greatly benefit from folic acid, especially when it comes to sexual health. Why folic acid? Because this nutrient plays a key role in the production of nitric oxide in the body. Essentially, folic acid acts as a switch that starts the process of achieving an erection. In fact, a study published in 2020 analyzed the effects of folic acid on erectile dysfunction in several groups of men. In this review, we included 9 studies that looked at blood folic acid levels in men with erectile dysfunction and men with normal erectile function. In total, 982 men with erectile dysfunction and approximately 850 healthy men were evaluated. The results were alarming. Men with erectile dysfunction had significantly lower serum folic acid levels, with an average difference of 0.94 nanograms/ml. This decrease in folic acid is directly related to the severity of erectile dysfunction. The lower the folic acid levels, the lower the ability to maintain an erection. And if that wasn't worrying enough, in another study done with men with diabetes, those taking a daily dose of 5 mg of folic acid along with tadalafil, Cialis, showed significant improvement in quality about their erections compared to those who only took the drug without folic acid supplementation. This brings us to an important point. We're not just talking about a supplement that can improve erectile function, but rather a compound that, by increasing nitric oxide levels, contributes directly to vascular health. Better circulation not only improves sexual function but also helps prevent other cardiovascular complications, is a common risk factor in men over 50 years old. Currently, the dosage and duration of folic acid used to treat erectile dysfunction are still not completely clear. Studies have used doses ranging from 0.4 to 5 mg per day, and effects vary depending on the case. What is evident is that maintaining adequate levels of these nutrients can make a big difference to men's sexual health, especially in people who also have other risk factors such as diabetes or hypertension. So how can we optimize folic acid intake? The first thing we recommend is to always consult your doctor before starting any supplement, especially if you are taking medication for other conditions. Folic acid can interact with certain medications, such as anticonvulsants, and it is essential to ensure that its use is safe in each individual case. That said, you can not only increase your folic acid levels through supplements but also through diet. Some foods rich in folic acid include green leafy vegetables, like spinach, broccoli and lettuce. Legumes, such as peas, lentils and beans. Fruit, such as bananas, melons and oranges. Natural juice, such as tomatoes or orange juice, are good sources of folate. Internal organs, like liver and kidney, it also contains high levels of folic acid. Now, an important fact for those who want to maximize their absorption of this nutrient: folic acid is a water-soluble vitamin, meaning it is water-soluble and can be lost during cooking. To avoid this, we recommend eating these foods raw when possible or steaming or microwaving them because these techniques preserve folate better. In addition to incorporating these foods, it is essential to adopt a healthy lifestyle in general. Regular exercise and a balanced diet not only improve erectile function but also help control weight, reduce stress and improve heart health. All of these factors are interrelated and play an important role in men's sexual health. And that's all for today's video. Tell me, do you want to learn more about sexual health and how to improve it naturally? Leave me your comments below, I will read. If you find this video useful, don't forget to like and share it with your friends and relatives. Remember, every action is important to take care of our health and that of those around us. Together, we can build a healthier world filled with happiness and prosperity. Thank you for your support. Wishing you all good health, success and see you in the next video. See you soon.